Hope you guys are doing well. Today, I just wanted to drop in and post the slides for the practical exam for histology. Hopefully, you guys would use them for your exams, and this includes probably both medicine and dentistry. These are the slides, and so we're going to start with bone. Most important thing here we have to know is that there's canals within the bones and haversian canals, and they're surrounded by osteons. Skeletal muscle, this is how skeletal muscle looks like. Cardiac muscle, on the other hand, has a lot of nuclei. Nerve fascicles. Blood, you have to recognize granulocytes and agranulocytes. That's how the blood looks like, and that's the blood vessel. That's the artery in a vein. Tunica interna is the most important part here of the aorta. Lymphoid node has the medullary cord inside and the subscapular sinus right here, just below the cortex. Spleen, it's a lymphatic organ, so you just connect the presence of the lymphatic nodules present. All of this is still spleen. Thymus looks like that and has the Hassalls body inside of it. Thyroid has colloids. They produce T3 and T4, thyroid hormones. Parathyroid, adrenal, and you have to recognize those three layers, and it starts by zona glomerulosa, fasciculata, and reticularis. Hypophysis. Lip, tongue, and you have to recognize Filform papillae. Parotid, you have to recognize Serous and intercalated ducts. Sublingual gland, Serous and mucous cell. Tooth, palatine tonsil. Esophagus, stomach, chief cells and parietal cells. Duodenum contains Brunner's gland right here. Small intestine contains intestinal glands in these villi. Large intestine as well contains intestinal glands. Appendix that has lymphatic follicles. Liver, portal tract, and has bile duct, portal artery, and portal vein. That's the liver circulation. Pancreas contains islets of Langerhans. Nasal cavity has a vein right here. Trachea, trachealis muscle. You can find the trachealis muscles right here. Lungs, bronchus and bronchioles. So these are bronchuses, alveoli, and bronchioles. Kidneys, you have to identify renal capsule, distal and proximal tubules here, renal corpuscle, sorry, distal tubule and proximal tubule. Ureters, bladder, testes, spermatogonia and spermatocytes. So here, spermatogonia, spermatocytes, closer to the middle. You have Sertoli and Leydig. Then epididymis, vas deferens, prostate, ovary, oviduct, uterus, thick skin, thin skin plus hair, identifying of sebaceous gland and the erectile pili muscle. Hair shaft right here, thin skin, that's mammillary gland, eye, cornea, iris, ciliary body, and retinal layers. You have to know all of these. From here, we can see that our cornea is right there, sclera, ciliary body, iris, layers right there. So 1 to 7. This is the most outer part of the eye. This is the most inner part. So from 7 to 1, we're going from out to in. 7 to 1, out to in. Okay. These are the layers. You have to memorize them. Eyelid, kidney circulation, bone development, inner ear, tympani, organ of Corti, media and vestibuli. Brain, cerebellum, Purkinje cell. It's just a line I'll show you here. So you have molecular layer, Purkinje is just a black line, granular layer. Ganglion. Okay, spinal cord has motor neurons. Now here, in this, we have to recognize that there's a rough endoplasmic reticulum right here. We know that these ribosomes are around it. That gives it this rough look. So that's the rough endoplasmic reticulum. Here we found Golgi apparatus right here and maybe here. Here we have mitochondria. We have the nucleus, the fragment of the nucleus. We have the nuclear envelope right here. We have the Golgi apparatus. We can see right here the ribosomes just surrounding the rough endoplasmic reticulums right here, and then you have smooth ER. That's just the vague area, gray area right here. And then finally we have the nucleus, have euchromatin, which is the pale area, heterochromatin, dense DNA, so hence dark area, nuclear envelope, which is the envelope surrounding the nucleus. Nucleolus is this black spot within the nucleus, and the nuclear pore is basically the pores on the surface of the nucleus. That's the end, and I hope this is helpful.